first like to say congratulate the London InterCommunity Health Centre on its 30th anniversary. It's hard to believe that it's 30 years since Shandy Radcliffe and Martine Lundgren had a dream and came up with the idea of the need for a health centre.
It was what you might call the best of times and the worst of times. New populations were coming into the country, and I think it was generally recognized that the current system did not really answer all of the needs.
I got a phone call from Shanty, and my title at the time was Economic Strategy Coordinator. Sometime later, and asked if I'd be interested in being on the board. And that certainly was an offer I accepted, and I was very glad to accept, actually.
So we set up a system with funding from the Ministry of Health to develop research programs on the ground to see what the difficulties were that these new communities were experiencing, and then make an effort to devise some kind of response to how we could improve the system to answer their needs.
We had a board of directors of about 10 people, and it was an excellent board because it was interdisciplinary. We had members from the different health fields, social service fields, volunteers, and community workers. So it was interdisciplinary and worked well.
Some of the challenges were meeting the needs when the needs exceeded the actual program limitations that were out there. The people themselves and their condition always was the big thing in the minds of everybody who worked here. You came here to serve needs that otherwise would just slip through the cracks, and so that was paramount.
There was no other community health center anywhere that was doing work with multicultural populations, so to put it bluntly, we were flying by the seat of our pants. And we had to make it very clear to get collaboration that though we expected hard work, we also expected people to have fun. And because out of fun comes the learning, because out of fun, if you had failures, which you would do in a new and experimental situation, you would then be able to handle that and learn from it. It's taking an individual as an individual, learning all about them, especially if they are complicated and need different inputs from different areas of care. But it was a collaborative creativity that we were looking at. Create, but with other people. So the culture of the organization was hard work, but go after what excites you, where you think the center should be going, because there are no guidelines, there are no goalposts. We know where we're going, but there are many ways to get there.
We are, at least in London Middlesex, taking a lead role in this person-centered approaches. The person is in the center and their needs are identified and understood and then met in a variety of ways to help wrap care around people and meet them where they're at. I think that's really another important value and principle, is that we don't judge people, we meet them where they're at and we provide what they need in that moment.
What inspires me is how our staff create a sense of belonging while they play a pivotal role in improving the health of the people that they serve. Our staff are heroes, and I say that any chance I get because they're phenomenal. When the Syrian influx came to our community, welcoming newcomers from Syria, we created a clinic at the Cross Cultural Learner Centre to support newcomers as they arrive in our community. was highly entrepreneurial and just based on what the needs of the community were at the time. And we remain there to this day.
You know, I really think it is about social justice. It's about serving people and being a part of our community. We just see, you know, the gap growing between those who have and those who don't have is growing all the time. So I think those rising inequities and then the relationship between those things and some of the on-the-ground things we see here in London, certainly poverty, homelessness, but also then substance use, and combine that with our poisoned street drug supply, and you see overdoses and unfortunately quite a lot of deaths, especially for a community the size of London. So, you know, we do have challenges. Organizations like ours, you know, we do more with less, but we can't not do it because the people that we serve need us and we need them.
In care, part of our value is not just treating the sickness that's in front of us or the illness that's in front of us, but recognizing that our clients are whole people that have needs beyond just their acute medical needs. So our teams work collaboratively to meet the full needs of clients across the spectrum of social determinants. And I think that that's more transformative in many respects than some of the medical care that we provide. In fact, I think it builds the foundation that allows us to provide such good care. So we build community here. We don't just treat illness, we build community, we eliminate social isolation, and we really create a place where everyone belongs. Our teams right now, when they provide care, have confidence that they're providing excellent care at InterCommunity Health Centre. So I wish that a way that we could support marginalized people better as a healthcare system is to take an equity-informed approach to how we provide care, not just at community health centers, but across healthcare. So people are engaged as part of their healthcare team. People are not judged. They are not stigmatized, and they are treated as whole people.
I see us at the forefront of an integrated primary care sector that is integrated within the broader healthcare system, where there are seamless transitions between primary care and secondary or specialist care, hospital care, and then back from hospitals into community, and people are never left stranded. And I see us being leaders in that sort of model, because that's the work that we do.
I do hope in 20 years that the number of people that need our services will be far less, because the system is far better at providing equitable care. But for those in our community that need us, we'll continue to be here and we'll continue to support in the way that we do into the future.
Try and meet the healthcare and health promotion, health education needs of the future. It's challenging, but certainly very rewarding, and I wish them all the best in the next 20 years.